I'm Beth Ferdinand. I came in actually as a little birthday gift to myself because I was having migraines constantly, and they would just be sort of from temple to temple and sometimes ranging all the way back into the base of my skull. I had seen an ad on Facebook that brought me in that included x-rays, which I don't really know why, but that was really interesting to me. I hadn't had that done before, an adjustment before. I made my appointment. I came in, we did very thorough x-rays, went through my first adjustment, and then my next visit, I came in and sat down with Dr. Carey, and he showed me my spine, and I learned some very interesting things. So at 31 years of age, I finally learned that I have a birth defect, and that is actually why I need adjustments regularly.
With Beth's case, we definitely want to adjust the lower portion of the neck to get her curve to come back in position, but the reason why the x-ray was so important is because she would have never known that she did not have the full posterior arch of that C1 vertebrae, and so that's why we do very thorough x-rays to make sure that we work on the musculature of this portion of the spine, but we would never really adjust that C1 if we don't have a full bone intact there. So that was a very important finding that she would have never known had we not taken an x-ray.
I started doing 3 adjustments a week after learning about my defect in my spine on my C1, and now I'm down to just 1 adjustment a week. Before I was getting regular treatments with my adjustments, I had easily 1 massive migraine a month, sometimes 2 a month, and sometimes they would last for a couple days at a time. We tried 800 milligram ibuprofen, we tried Buta something or another, it has caffeine in it, that's for headaches. We tried cetrizanidine, we tried cyclobenzaprine, and we tried tizanidine, all of which, most of them didn't actually help anything. It didn't help prevent, and you wouldn't want to use a muscle relaxer for a preventative anyways. Obviously, we have to worry about addiction, and because of that worry, I was not keen on using them to begin with, even after I had a migraine. So I just felt really stuck in a treatment plan that wasn't for me. Coming to Well Health for my adjustments, I was now able to stop all of those medications. I no longer need them, and I don't really have migraines anymore. I don't think I've had a migraine in 4 months, 5 months. Actually, I can't remember the last one I had. Ready? So as a mom, I noticed that Kellen was starting to have some digestive issues, so we started bringing her in every other week for adjustments to help keep things moving, because as Dr. Carey explained to me, when a nerve gets pinched, things start working improperly. So we started getting her adjustments for digestive issues, and then as it helped with that, we also noticed that it started helping her after particularly tough gymnastics practices. She's on a USAG team, a level 3, and so with that, she's actually practicing 12 hours a week. So that's 3 days a week at 4 hours per practice. So her body goes through a lot every single week. So we've noticed that those adjustments really help her to keep everything in line, and it really seems to keep her going strong through her practices, so she's not as achy in her bones. Kellen was 8 when we started. She's 9 now, but she'll be 10 at the end of the year. So we've been getting her taken care of here at Well Health for a year and a half, I'd say. You should come to Well Health for all your needs, believe it or not. It can help with just about anything, but I especially recommend it for headaches. You can't go wrong.